Disaster Management and Environmental Health for 10th semester students of the Faculty of Medicine. Disaster management and environmental health are two important fields often taught in public health courses during the 10th semester. These fields aim to train medical students to understand the relationship between disasters, the environment, and health, as well as to provide the skills needed to respond to and mitigate the health impacts of disasters on communities. 1. Disaster management in health. Disaster management is a systematic process of preparing for, responding to, and recovering from health impacts caused by natural disasters, human-made disasters, or disease outbreaks. In the health context, disaster management includes efforts to reduce the health consequences of such events. Phases of disaster management. 1. Mitigation. Efforts to reduce risks and impacts before a disaster occurs. Examples: constructing earthquake-resistant infrastructure, reforestation to prevent flooding, zoning regulations. 2. Preparedness. Preparing for potential disasters through training and public education. Examples: evacuation simulations, provision of medical supplies, training healthcare workers on emergency response. 3. Emergency response. Immediate response to save lives, provide medical aid, and ensure the basic needs of the affected population are met. Examples: emergency medical services, victim evacuation, distribution of clean water and food. 4. Recovery. The process of restoring the affected community to normal or improved conditions after a disaster. Examples: rebuilding healthcare facilities, economic empowerment of affected communities, psychosocial programs for trauma victims. Types of disasters studied: natural disasters, earthquakes, tsunamis, floods, volcanic eruptions, droughts. Human-made disasters: armed conflicts, industrial accidents, environmental pollution. Public health emergencies: pandemics, disease outbreaks such as COVID-19, cholera, or dengue fever. Role of healthcare professionals in disaster management. 1. Rapid health needs assessment. Identifying urgent needs such as clean water, food, medicines, and healthcare services. 2. Coordination with multi-sectoral teams, collaborating with government agencies, NGOs, and international organizations in providing assistance. 3. Prevention of infectious diseases. Managing sanitation, vaccination, and community education to prevent disease outbreaks in shelters. 4. Psychosocial support. Providing mental and emotional support to disaster victims, including mental health services. 2. Environmental health. Environmental health is a branch of public health that examines environmental factors that affect human health. Its focus is to create a healthy environment and prevent health risks caused by environmental factors. Components of environmental health. 1. Clean water and sanitation. Managing clean water sources to prevent diseases like diarrhea, cholera, and typhoid. Examples: building wells, managing wastewater, educating about environmental hygiene. 2. Air quality. Reducing exposure to air pollution, which can cause respiratory diseases such as asthma or bronchitis. Examples: controlling vehicle emissions, managing industrial waste, reforestation. 3. Waste management. Managing domestic, medical, and industrial waste to prevent soil, water, and air pollution. Examples: recycling, household waste management, and incinerating medical waste. 4. Prevention of environment-related diseases. Preventing diseases linked to environmental factors, such as malaria, from stagnant water, and cancer due to exposure to hazardous chemicals. 5. Climate change and health. Reducing the health impacts of climate change, such as heat waves, floods, and droughts. Examples: early warning systems, agricultural adaptation, and environmentally friendly urban planning. 3. Integration of disaster management and environmental health. Disasters often worsen environmental health issues, requiring an integrated approach in public health responses. Examples of integration include providing clean water and sanitation in shelters to prevent disease outbreaks, managing medical waste during pandemics or disasters, educating the public on mitigating environmental risks before disasters occur. 4. Topics studied in Semester 10-1. Risk analysis of environment and disasters. Assessing risks based on geographical, epidemiological, and environmental data. 2. Health crisis management. Responding to health emergencies caused by disasters, such as pandemics or disease outbreaks. 3. Disaster epidemiology. Studying the distribution of diseases resulting from disasters, such as diarrhea in shelters or acute respiratory infections. 4. Healthcare resource management. Ensuring adequate distribution of medical logistics, health personnel, and facilities during disasters. 5. Climate change adaptation and mitigation. Health strategies to address the effects of climate change, such as controlling tropical diseases. 5. Challenges and opportunities. Challenges: limited resources, shortages of healthcare personnel and logistics during disasters. Multi-sectoral coordination. Difficulties in uniting various stakeholders in disaster response. Impact of climate change. Increased frequency and intensity of environmental disasters. Opportunities. Digital technology. Using applications and platforms for disaster risk mapping and health education. Increased awareness. Global campaigns to reduce the health impacts of climate change. International collaboration. Cross-border assistance in handling large-scale disasters. Conclusion. Disaster management and environmental health are interconnected fields aimed at protecting public health from the adverse effects of disasters and environmental factors. In the 10th semester, medical students are prepared to understand the theories and practices of preventing, responding to, and recovering from the health impacts of disasters while creating a safe and healthy environment. With this knowledge, they can actively contribute to mitigating public health risks in a sustainable manner.